the BC Provincial Renal Agency operates as a virtual organization at the hub of a network of renal care providers. In partnership with the Provincial Health Services Authority, the Ministry of Health, and the province's 5 regional health authorities, the Renal Agency funds and guides the activities of BC's renal care professionals and sponsors a variety of committees, professional groups, and working groups, all focused on making British Columbia a national leader in the delivery of renal care.
The Renal Agency was actually formed in 1997, and it was really the culmination of work that Dear 11 had already done to bring the nephrology community in particular together, and also to identify the importance of teams, not just the nephrologists, but the clinical teams, and to create what would be called a bottom-up process for having input from the trenches to establishing province-wide standards, guidelines, policies for clinical care.
Like any service in healthcare, the measure of success is how well the patients are cared for. And I think by any standard, the Renal Agency has some outstanding results in the care of patients.
One of the strengths of the Provincial Renal Agency is its focus on collaboration. It brings all different stakeholders from all across British Columbia together.
I think that nephrology from time immemorial has always been a team sport, and it's always been about the patient, and you can always get everybody to rally around. And I think that as a group of professionals in any, whatever the sphere was, we all agreed that working together was way better than working apart.
There's an openness to collaborating, sharing ideas, using research that's been done in one program to look at it for the whole province, so that we truly do the very best.
What the Renal Agency has done is brought the nephrologists together, the nursing units together, and they're working on best practices throughout the province. And they're supporting it with local research as well as international research.
They're able to share, best practices from hospital to hospital so that there isn't an issue that, I can get one care in Vancouver and another in Prince George, or even up here in the Okanagan. It's pretty much province-wide, and you get the care no matter where you live.
We've got a value-driven renal agency, and by that, what I mean is that the clinicians, doctors, nurses, social workers, nutritionists, they're actually actively engaged. They're looking at what's best for a patient, both in outcome and process. Then after that, we worry about things, the dollars that fall out of it, by treating people first and treating them appropriately.
You get good care if you're a renal patient in BC. There's no question about that. And we have had lots of positive feedback from people in other provinces and people in other countries about our programs.
In BC, we have the centralized agency that can make decisions about funding medications in the province, and that is essentially different from other geographic areas in the country where the renal programs don't have that central decision-making capability or the ability to fund those medications.
Funding is allocated from the ministry for facilities and equipment, and then a committee that is made up of representation from all the regions looks at all the requests that have come forward from all of the regions and looks at the money that's allocated, and then based on guidelines and a process that has been agreed upon by the renal community, decisions are made as to how the funding will be allocated.
And the advantage of that is pretty much we can identify, it's efficient first of all, and we identify the resources that we think we need to provide the kind of care that we think we need to provide, and if we make the case within fiscal limitations, we pretty well get what we need to deliver the care.
There's the notion, certainly, that most public organizations or agencies are driven by the dollar. And how do we get more with less, but how do we overall spend less? And I don't think that's true with the Renal Agency. I think it's more about getting the best service for everybody affected by kidney disease.
Because if they treat the patients appropriately and can measure that they're treating them appropriately, we're going to do it the cheapest, most cost-effective way. because we do it right the first time.
I think one of the huge strengths of the renal agency is the availability of information to make the best decisions possible.
The Promise database has really been what has driven our ability to be able to capture and report back to the government what our activities were, the costs of the therapy, because that was clearly something that was of importance, as well as the biologic outcomes.
We certainly use Promise for our medications, for our for our blood work that we print off for our monthly clinics.
So we use data or information about the services we provide and the people that we serve in order to take a look at what we're doing and then how we're doing it, and then to make changes based on good information.
They've given patient the self-management tools that they need to manage their care. Instead of going to the doctor and the doctor fixes everything, you're taught to be able to take care of your disease, and with doctors' help, of course, and support and all of that. But it gives us a lot more control, and we're a lot healthier and feel better because we do have some of that control. And being able to have like the home hemo machine where I can run as much or as little as I want. I can basically write the prescription I need to feel well and have an active quality of life, which is much better for me. I find it much better.
Although we've focused very much on having people going home, we also are trying to encourage people to do whatever level of independent care they can do. So maybe that's in the hospital unit that they help with setting up the machine, or they help with needling themselves, or even if it's just picking up a blanket, at least they're doing some degree of participation in their care and trying to find for each individual what their level of independence that's reasonable for them to try to manage.
I don't have statistics yet on how many people we have prevented from going on dialysis, but we know there are patients who have maintained their renal function for a number of years now with good management, both self-management and the medical management from their care providers. And we know that patients now are much more interested in being knowledgeable about their disease and taking an active part in their disease and in the disease management.
We're really a model for other chronic disease care programs in the province and should be across the country, because there's no other delivery system that I'm aware of in the province that is providing that level of that methodology and that diligence in actually planning to improve care, measuring the outcome of what we do, and making changes based on that.
BC Nephrology Days is very important for many reasons. Part of it is the renal community gets together to either present information or to hear others present, or have an opportunity to ask questions of a panel. People that are trying new things, people that are experiencing some similar issues, but maybe they're working in a different part of the province. And it's an opportunity to also get an overview of how we're doing as a province in terms of delivering care.
We bring the whole team together, and it's a team focus with our education. It's not just the nephrologists in one room and the nurses in another room and the dietitians in yet another room. We all converge, and we really reinforce the notion of a team in which everyone is important. Everyone is a leader.
One of the things that I appreciate about being a member of the Provincial Renal Network is the ability to move quality initiatives forward.
They do react quite quickly to new technologies, better practices, things that are happening in the world today, and it's not a long practice. If it's better for the patient, great. If it's better for them financially, even better, and it happens.
I drive people nuts throughout the healthcare system, telling them they should follow the Provincial Renal Agency model, and they should put the clinicians in charge, ask them to hold them accountable by asking them to show the evidence that they're progressive, that they're actually making a difference in patient lives, that the treatment processes are working the way the renal agency does.
I think this is pioneering work. I certainly have dialogue with people in other provinces and also in other countries. I was in the UK a couple of years ago and also have met with people in similar positions in the United States, and they all say that what we're doing here in BC is very innovative, and it has been driven very largely by the renal agency.
I used to change different areas that I work until I came to renal. And renal is changing every year, so it's still really an exciting area to be in.
I suppose in everyone's career there's the opportunity at some point, at least the hope there is, that reinvigorates why you're in that profession. And for me, the renal agency has been that we have, it truly is a community, and I feel welcomed and part of that team.
It's a huge privilege to be a part of growing something that actually is seen to be so successful. And then also to be allowed to continue to help make it evolve. So it's been very rewarding.